Hello and welcome to The Big Picture. I'm Tina Jha. The second wave of the COVID-19 pandemic has posed numerous challenges before India on multiple fronts: health, economy, and also the environment. On the show today, we will talk about one such impact of the COVID outbreak on our environment, and that is the exponential increase in biomedical waste. Data suggests the average quantity of COVID-19 related biomedical waste generation during May 2021, which is the ongoing month, is about 203 tons per day. The peak generation of about 250 tons per day was reported on the 10th of May. The earlier peak generation in the year 2020 during the first wave was in the range of 180 to 220 tons per day. Now, all of us know that biomedical waste poses various health and environmental hazards, and this is the wider challenge that the COVID pandemic has posed before us. So while there are guidelines to handle medical waste with utmost care and also dispose them of safely, the exponential rise in the quantity of biomedical waste due to the pandemic and also the lack of awareness on how to dispose them safely has made the task very challenging and also difficult. Today on The Big Picture, we will analyze with experts the biomedical waste management system, how challenging it has been due to the pandemic, and also the issues and solutions to tackle it forward. Joining me on the program are two distinguished panelists. So let me first introduce them to you. I'm joined on The Big Picture today by Dr. Sanjeev Agarwal, former Additional Director of the Central Pollution Control Board, and Mr. Chandra Bhushan, CEO, International Forum for Environment, Sustainability and Technology. Thank you to both my guests for joining me on the program today. Mr. Bhushan, let me begin the program today with you. So all of us know biomedical waste poses various health and environmental hazards. First, help us and our viewers understand the challenges in safe handling and disposal of biomedical waste at large, and how has the ongoing COVID pandemic aggravated it further?
Well, biomedical waste is a hazardous waste. It has both microbiological and biological contamination, which means that it has the potential to spread various kinds of diseases. And plus, we have various medicines and which are also toxic in nature. So both from chemical perspective and biological perspective, biomedical waste is hazardous to humans. And therefore, we have a separate law, biomedical management rules, to manage biomedical waste. And we have a separate facility, which is called as Combined Biomedical Waste Treatment Facility. And we have about 200 such facilities in India to manage biomedical waste. So the first point is that it is a special kind of waste, and it has to be managed very, very carefully because of its potential to cause harm to all of us. Now, COVID has added another challenge right now, because the COVID waste is not only being generated in the hospitals, but it is also being generated in homes. In fact, 80% of COVID patients are recuperating or have recuperated at home. They have been, they were quarantined at home and they have recovered there, whereas only about 20% had to go to hospital. So the biomedical waste challenge has become a little more complicated in COVID case, because 80% of patients have generated some amount of biomedical waste at their home, and we do not have any kind of facility to manage that biomedical waste. Essentially, that biomedical waste has been dumped in the normal municipal waste. Whereas at hospitals, you have some kind of system. In fact, good hospitals have very good system to manage biomedical waste, whereas some provincial and local hospitals don't have that kind of facilities. So overall, while the quantity doesn't seem very high, I mean to say, the data that you have just told all of us is about 250 tons of biomedical waste, COVID waste, being generated per day, whereas at the peak, our total biomedical waste generation is about 1,000 tons. So COVID waste is only about 25%. And our total capacity to treat biomedical waste is also about 1,000 tons per day. So on the big picture, it seems that we have a system to tackle, but because we are generating a lot of these waste at home, Plus, at the provincial and local level, hospitals don't have good facilities. The COVID waste is getting mismanaged. And in fact, I want to end by saying, frankly, because we are generating so much biomedical waste at home, the frontline workers are municipal workers. And in fact, data shows that they have been impacted extensively during this pandemic. Many have died also. They are also our unseen hero that we need to applaud for the kind of effort they have put in to keep all of us safe.
Absolutely. So going forward, how are we going to do this and ensure that we keep our frontline workers, the sanitation workers safe is something that we'll discuss in the course of the program. But Dr. Agarwal, coming to you, the biomedical waste management system earlier as well was facing challenge, but with this pandemic, a whole new dimension, a whole new challenge has been added to it. How are we dealing with the tons of medical waste that is being generated due to COVID? What are the SOPs and the guidelines that the CPCB has put in place that are supposed to be followed for safe and effective handling of the COVID waste?
Yeah, basically, historically, if you see that biomedical waste rules came into 1998, and after that, there are so many amendments, First Amendment, Second Amendment, Third Amendment, and everything is given in the rules. What rule says? Rules says that it should be properly collected, disposed, treatment, handling, etc. All these things are included. Basically, this rules says that uh, all the data which we are collecting from the state pollution control boards and state agencies, that has to be submitted to CPCB, and finally it should come. Finally, it should go to the Ministry of Environment and Forest. So there are forms, five schedules, three schedules are there, and five forms are there. As per that collection of data through this facility, we are collecting the data of hospitals, we are collecting the data of various other places where the hospitals waste is coming. So treatment is also there, that is incineration and some kind of gasification and torch technology, where the treatment is given first and then finally it will go to the any kind of landfill sites. One more thing I would like to mention, that after 2019-98, there are amendments, then finally it has come again, revisited in 2016. So that rules are more advanced, and basically it covers many things. And then 2018, again, we have the rules amended slightly. And 2019, recently, we have added many other things. And this particular rules include the color coding of the containers and all. Basically, this waste is an infectious waste. So we must care it. We should not throw it. We are not saying that you segregate it. We are saying now, as per the rules, we are saying that you simply collect it and then dispose of. And before disposal, either you treat it or you properly keep it in a proper container. Actually, color coded containers are there as per the rules. And this kind of data all over the India is coming to CPCB. And finally, we are submitting to the final report, we are submitting to the Ministry of Environment and Forest. So this is a democratic way where we are getting the data, and we are doing some actions on that.
Okay, Mr. Bhushan. So SOPs are there in place, the rules are being followed, and we all know waste segregation is very, very important. But looking at the sudden and exponential rise in medical waste that we have witnessed due to this, raging pandemic, the second wave of the pandemic, do you think this procedure is being followed for segregation? Because earlier on you highlighted how the people are not aware as to how to segregate it at source, and this perhaps is the larger concern.
We are not, as I said, that we are not managing COVID waste very well at homes because we do not have systems to manage biomedical waste at home. Our system is designed to tackle biomedical waste in health facilities. So all the legal provisions that we have right now is to deal with biomedical waste in hospital setting. Whereas, as I said, 80% of COVID patients are getting treated at home. They are quarantined at home. And therefore, whatever biomedical waste that they are generating at their own place. Unfortunately, we have not created a system to collect separately and to dispose that waste into biomedical waste treatment facilities. So the challenge in COVID is, and I think it is very important to understand that 80% of patients and the waste they generate are being generated at places where there is no system for biomedical waste. Now, the second issue is that we have about 200 biomedical waste treatment facilities across the country, but they are in certain districts. Delhi has few, Mumbai has few, but in far off corner of the country, there is no biomedical waste treatment facility. There again, in the hospital setting, biomedical waste is not being managed very well. So while we have law, and in fact, I must congratulate Central Pollution Control Board, because just when the first wave of COVID had hit us, they came out with a very clear guideline as well as a mobile app on collecting data on biomedical waste. So there was this attempt by Central Pollution Control Board to manage biomedical waste. But unfortunately, the second wave of COVID has hit us so hard that, I don't think that even hospitals are uploading data. So the data that you have mentioned about 250 tons per day, I'm expecting actually the data should have been far, far more than what people are reporting to Central Pollution Control Board. Because both in terms of numbers and quantity of waste, this time it has to be far, far higher than the first time. And first time was about 200 ton. This time it cannot be 250. It has to be more than 500 ton of biomedical waste, at least COVID-related biomedical waste that we must be generating this time.
Okay.
So there is challenge.
Very important point there made by Mr. Bhushan, that, the biomedical waste activities obviously are being monitored, regulated well in the healthcare facilities. But what about in times like these when 80% of the people are recuperating at home due to lack of awareness or due to our systems not well equipped to, take care of biomedical waste system at home? How big is this challenge, and do we have any SOPs at least ready for if we are hit by a third wave?
Yeah, actually, there are SOPs also available, and World Health Organization is also giving the SOPs for maintaining this kind of. So, what I'm saying that SOPs are available. People has to follow the SOPs. Not only WHO, there are several other agencies, health agencies, and other people. They are just releasing the various SOPs to control this kind of infection. Also, there are the whatever the waste is generated is being collected. It should be collected. In fact, it should be collected properly, because if it is getting infected to either water bodies or anything, then it will be a very big challenge and big problem, because it should not mix with anyone, with any kind of waste. It should not mix with the municipal solid waste. It should not mix with the other things, and it should directly go either incinerate or it should be gasified. So there are technologies are available, and and this particular thing is basically taken care by the respective agencies.
Okay, Dr. Bhushan. So the thing is, we've been hit really hard by this second sudden wave of the pandemic. There is, of course, poor practice of segregation at source of generation. That is something that we've already discussed, and this is hazardous to the frontline workers who we have seen how even in the first wave and now in the second wave have been the most vulnerable. Several of them have lost their lives. But if we talk about the risk to the environment, how damaging is it if we are not segregating this biomedical waste properly, especially the COVID medical waste? How damaging is it to the environment?
Very damaging. I mean, to say the potential of biomedical waste to spread a disease through environment, either by polluting the water, largely by polluting the water, or if we are incinerating it or we are throwing it like that, an infection to the municipal worker, the potential is extremely high. As we have not studied, either during the first first wave, or maybe even now, we do not actually understand how many people have got infected through biomedical waste itself. Okay, our general assumption is that people are getting infected through respiratory droplet and aerosols and by touching the surface. But I am very, very confident that as we are not managing the biomedical waste very well, there may be a large number of people who are getting infected because they're coming in touch with those biomedical waste. Okay, so the potential of infection being spread through biomedical waste is very high. I'm sure that we are not collecting the numbers, but there must be, especially for municipal workers, for sanitation workers. They must be getting infected through biomedical waste. That number must be very, very high. The second issue is that, we have seen people throwing bodies in the rivers, dead bodies in the rivers. That is also a major source of pollution. Okay, I mean to say, even if the river is Ganga or any other river, the chances of pollution through dead bodies is again very, very high. So that is also something that we need to really take care of. And the administration should ensure that such a practice is stopped very, very strictly and is not allowed.
Absolutely. Dr. Agarwal, very, very important point that Mr. Bhushan is making, that if this waste is not managed scientifically, looking at the situation that we are in, it is going to cause great harm to human health and also to our environment at large. So then what is the way ahead?
Actually, what I suggest that we, along with the waste which is generated from the biomedical area, that must be taken care very, very enthusiastically and also very carefully. But what I would say that we should also taken care about the nature, biodiversity, and whatever the resources available, we have to use the judiciously. We should not go for any kind of thing which can create the challenge to other things like climate change and like other things. So I would say that whatever the waste is generated, that must be taken care. And as per the rules, rules are available there. As per the rules, they must be taken care. And the state agencies, those who are collecting these kind of waste, I think they are basically very, very important. All the data which is coming for at Delhi, New Delhi office, that should come. That data should be very important, because if it is any wrong data is coming, then it will be it is not a good thing. So I think we must do it this kind of challenge as a we must taken care of this particularly.
Okay, and in addition to the guidelines, Dr. Agarwal, how can we raise awareness among people? Because for the layman, biomedical waste and municipal waste is the same. They are disposing it off in a similar manner. So how can they be made aware as to how to segregate it? That is the most important factor.
Yeah, most important. Awareness is very, very important. And what I say that generally when the state agencies are involving in this kind of biomedical waste, they are showing the color coding and colored containers. So the red container, that means the biomedical waste is highly infectious, highly hazardous. So this kind of color coding is very important in the rules already given. So this awareness should be, I think, should be more spread to the state agencies. State people means the local people there, so that people should know that they should keep themselves away from this kind of waste.
Okay, Mr. Bhushan. So what perhaps is causing damage to the environment is one of the major pollutants. The same plastic has, in a way, saved so many of our doctors, so many of our frontline workers from this very unprecedented pandemic that we've all been hit by. But is there another plan? Is there any alternative that we can think of to reduce this waste burden in the times to come? Because if we are to be hit by third waves, fourth waves of the pandemic, and if this COVID pandemic prolongs, we must think of an alternative to reduce the waste burden.
Absolutely, but I am not so much bothered about the plastic component of biomedical waste right now because this is not a long-term challenge. It is a short duration, increase in plastic waste that we can manage if we are smart. If we have system in place, we can manage. Because at this point of time, we also need to give confidence to people, and of course, single-use plastic mask or PPE is giving confidence to people, which is also very important.
Absolutely.
So, but what I want to add here is that immediately I think it is important that Central Pollution comes out with a SOP for managing biomedical waste at home. That is the most important thing. The second thing is, while I will not encourage burning of biomedical waste in urban areas because air pollution is already very high, in rural areas, I think the option of burning biomedical waste is there, or even burying it in the pit. So in the SOP, I think it is important that we give clear indication to both, rural communities as well as urban dwellers what to do with biomedical waste which is coming out of their homes. And the last thing is that the principal scientific advisor of the country is coming out with very clear guidelines on how to manage COVID. And it is important that the principal scientific advisor also comes out with SOP for managing biomedical waste, COVID waste. And it is publicized widely. These are some of the things that we need to do urgently, even in the second wave, so that we are much better prepared in the third wave.
Absolutely. Awareness drives is the need of the hour, and only then we can take care of all these challenges that the COVID pandemic is posing before us. Dr. Agarwal, what do you think as an immediate measure? What is the efficient?
I want to just interrupt one thing. I remember that last year when the pandemic came in March 2020, I remember that on the website of CPCB has put one kind of SOP, which is public. People should see it because, as mentioned by Mr. Bhushan, that SOP is not available, but I think it is available, and CPCB has already placed their SOP how to manage it on their website. I remember it's almost 1 year. So,
but perhaps not as widely publicized, sir, because the common man perhaps is not aware of such SOPs, such rules which are there in place. So I think the need of the hour is to make people aware that such SOPs do exist, and people must be made to follow these rules very, very strictly.
Yeah.
Okay, so one final question, sir, from you. As an immediate measure, what kind of an efficient strategy do you think we need to deal with this looming threat?
Basically, we must keep ourselves away from this kind of waste. First thing, we should be at quarantine at home. We should not go out. Whatever the waste is generated from the home, or maybe a dead body, or maybe a kind of thing, it should be. It may be highly infectious. So I think we must take care. We should keep all these things in a such a way that it should not spread again. And to prevent this, I think all this kind of color coding again we can advertise, or we can advisory should come from the government and saying that these things, how to tackle these things, it is very important and should be publicized. Yeah.
Okay, Mr. Bhushan, so we've spoken about handling of the biomedical waste, but how can we strengthen our disposal mechanisms? How can we make it more robust and safe?
Absolutely. I mean to say segregation is going to be very, very important, and therefore awareness is going to be very important. People must understand that they cannot put, even if they are not infected, they should not put their mask and gloves in the same municipal waste bin that they have. It should be kept separately. So segregation is going to be very important, both for single-use plastic item that people are using, PPE, personal protective equipment, as well as if they are infected, then that waste should be kept even more separately. So segregation is going to be very challenging. I will encourage people to keep the waste at home at an isolated place. And then, when the waste collector comes, they should be informed very clearly that this is an infected waste. And then they will have to find a way to manage it, or even call a hospital which has a biomedical waste treatment facility. So I think segregation, informing the waste collected that it is an infected waste is going to be very important. And then, district administrations will have to come out with a very clear guideline on what to do with that waste. Where will that waste go?
Absolutely. So even segregate biomedical waste at homes, the exercise is futile if the municipal bodies, if the waste collectors do not know where to dispose it of, and ultimately if it reaches the municipal waste and is put together, then the whole exercise of segregation becomes futile. The ultimate goal, obviously, for all of us should be to drastically reduce environmental damage, which is posing the COVID pandemic and the biomedical waste. The exponential rise that we have seen over the past few months due to the second wave has led to a lot of hazards. We have to all understand that a healthy environment at the end of the day is essential for a healthy life, and that is what should matter to all of us. So with that, I'll have to wrap up this edition of The Big Picture today. Thank you once again to both my guests for joining me on the program and sharing your perspective with us and our viewers. Pleasure having you on the show. Take care of yourselves and your families. To my viewers also, I want to make an appeal. Take care of yourselves and your families. Stay at home if you can. The unprecedented crisis is yet not over. We are still going through the second wave of the pandemic. Stay at home, but if you go out, make sure you are double masked up, ensure physical distancing, and also keep washing your hands at regular intervals. We have to go back to the basics that we have been doing ever since the first wave, and this is what is going to protect us from the infection. So take care of yourselves and your families. See you again, same time tomorrow. Until then, bye-bye.